Here are the 4 blocks for assistance. STF2. Support, treatment, financial, and face-to-face. You handle a lot of tasks, duties, and situations working as an assistant each day, but you know that you're doing your part to help patients and the whole team when you 1. Assist the team as multi-talented support staff, using your exposure to all parts of the practice to enhance your understanding of the process of patient care. 2. Perform treatment tasks with an eye toward the full team process of patient care and a commitment to excellence and patient comfort. 3. Maintain an understanding of the financial aspects of patient care and assist in the plain language delivery of treatment and payment plans. And 4. Help develop and maintain patient trust and positive expectations toward diagnosis, treatment, and overall experience while maintaining warm, open communication with patients and teammates. Support. You contribute to the success of the whole team and the practice as a whole by supporting the process of patient care in a number of ways, from assisting in treatment with doctors to helping the hygiene department with instruments. To help you master your role, you'll be given effective actions to focus on from time to time. To give some examples in no particular order, here are some 4-block tasks centered around support that you will master working as an assistant. Four-handed dentistry, room setup and cleanup, using downtime to help the hygiene department, working with other doctor teams, and sterilizing instruments for your team and others. Here are some sample effective actions. 1. Anytime you flip a room for a bonus patient, swipe. 2. Anytime you flip a room back to back and have the patient leave on time, swipe. 3. Anytime you do instruments for another doctor or hygienist, swipe. 4. Anytime you assist another doctor with a patient, swipe. 5. Anytime you facilitate a complete anesthetic setup in a hygiene room, swipe. 6. Anytime you coordinate and book treatment for a patient in a hygiene or doctor room on the spot, swipe. Treatment. In addition to the treatment you assist in, the treatment tasks you perform on your own are an important way that you care for patients, support the team, and contribute to the success of the whole practice. To help you master your role, you'll be given effective actions to focus on from time to time. To give some examples in no particular order, here are some 4-block tasks centered around treatment that you will master working as an assistant. Taking radiographs, taking intraoral pictures, computer input, taking impressions, and pouring models. Here are some sample effective actions. 1. Anytime you take an impression for a night guard, sports guard, or whitening that was not pre-booked, swipe. 2. Anytime you take and explain an intraoral photograph to a patient during treatment, swipe. 3. Anytime topical is placed prior to the doctor entering the room, swipe. 4. Anytime you tell a patient to expect an aftercare follow-up call, swipe. Financial. You contribute to patient care and the success of the practice as a business with your understanding of the financial aspects of treatment, which allow you to build on the trust that you develop during the time you spend with patients to assist in plain language with the presentation of diagnosis and treatment and payment plans. To help you master your role, you'll be given effective actions to focus on from time to time. To give some examples in no particular order, here are some 4-block tasks centered around financial that you will master working as an assistant. Completing pre-auths, discussing insurance coverage, care credit knowledge, understanding patients' financial perspective, and creating treatment and payment plans. Here are some sample effective actions. 1. Every time you discover a coverage restriction prior to treatment completion, swipe. 2. Every time you discuss and coordinate the patient's personal obligation for treatment, swipe. 3. Every time you book an emergency patient for a follow-up new patient exam, swipe. 4. Every time you comment to a new patient that they will love the treating doctor prior to meeting them, swipe. Every time a patient accepts a treatment plan for treatment over $1,000, swipe. Face-to-face. Everyone in the practice needs to practice good face-to-face. If we connect warmly on a human level to establish trust and open communication, we can give exceptional care to patients and support each other as a team. As an assistant, you contribute to the positive impression patients have of the hygienist, doctor, and the practice as a whole, and set the stage to build trust and loyalty. To help you master your role, you'll be given effective actions to focus on from time to time. To give some examples in no particular order, here are some 4-block tasks centered around face-to-face that you will master working as an assistant. Preemptive positive comments about doctor and hygienist's care. explaining procedures, patient transfers, assistant to hygiene transfers, and making follow-up calls to patients. Here are some sample effective actions. 1. Every time you reference a purple personal note and patient conversation, swipe. 2. Every time the patient laughs, swipe. 3. Every time you make a purple personal note, swipe. 4. Every time you make a positive comment about an associate dentist, swipe. 5. Every time you make a positive comment about the weather, swipe. 6. Every time you include an observing child in the treatment process, swipe.